The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Well,
oh man, we are like taken by those pictures from
We
Dr.
are
Gonzalez. Dr. Gonzalez, good morning. Let's
morning,
get that
sir.
mic
How are
close to
you?
you. I'm
Yeah.
doing great. Always happy to have you here.
Thank you.
oh my heavens, I am. I'm just breathless from that. So people, Dr. Mencia, people really come in with those problems on their legs?
You know, it's amazing, Dr. Gonzalez, when I see a lot of patients. And nowadays, you know, us men, when it comes to taking care of our body, we used to be not like women. Women will take good care of their body, their diet, and that's why we used to die a lot younger than women. Now men are more into looking into their body, taking care of in their body, and you get those patients. I saw those pictures you showed me of one of my patients with a severe varicose vein. But usually I look at my patient, and when I'm examining and I see some varicose vein, I say, listen, we can do something about it. We can work on it.
Absolutely.
And a lot of times, you know, in the past 5-10 years ago, thank God that now you are right there in the office.
Right.
So they can just see you and get an opinion from you.
Right.
But in the past, it's like, you say, okay, so I'm going to send you to another doctor who I really don't know well. And I
Right.
don't know their bedside manner.
Correct.
And now they come and they see you with small varicose vein, and it's interesting to look at that picture to see when you have varicose vein, how severe they can get.
You can get.
And what are the risk of letting varicose vein get so advanced, beside the aesthetic of it?
Right. So as you suggested, this patient that we were discussing earlier and showing the pictures had this varicose vein for more than 20 years.
Wow.
When he was younger and living in the north, obviously, you know, using long pants and, you know, clothing for the cold weather, he didn't pay much attention to that. It was later, until many years later, that he started having a lot of tiredness in his leg, and he attributed that to old age. But his leg has been getting swell, very heavy, tender. He told me that at night, for many nights, he always have a lot of pain in his leg, and he couldn't sleep well. So obviously that affected his sleep cycle. Next day he feel restless, and this continued building up year after years. His skin the skin in the leg become very stained because of this continuous pooling of blood in his leg. And this varicose vein are oozing fluid into the intertissue, to the tissue surrounding the veins. So over the years, there are significant staining of the leg, swelling, and thickness of the skin. So the skin becomes like leather. And by the time that we met this gentleman that has been now on wound care at a nearby hospital for a long time, I say several years already, with recurring ulcers that come again and again. It's happened because that skin has been so damaged for so long. And you suggest, men in the past, we used to say, well, we have varicose vein, leave it alone, not a big deal. That might actually be a good thing, like I look like a macho man with these big veins in my leg,
exactly.
in my arm. But when they are healthy, we have no problem with that. They are healthy. But when we do an ultrasound and we find that they have severe reflux or severe leaking of the valves inside the vein, and this patient is having pain, swell, discomfort, heaviness in the leg, that's when the problem is, and that's when we should take care of them before this permanent damage in the skin, before the skin becomes like leather, before the skin becomes a stain. It's like a tattoo, become a stain and permanently for life stain with these black spots
Those
in the inner thigh of the leg or outside of the leg.
But Dr. Gonzalez, excuse me, and Dr. Mencia, how does someone let it get to that point? I mean, if you have a leg and all of a sudden it starts to get a little bit strange, why don't you rush to the doctor?
Well, they go, let me tell you, a lot of time we go to the primary care doctor, and that's I think I had to talk to you as a primary care physician. And a lot of time when the patient go to the doctor, they usually say, look, I'm getting this dark spot on my leg, and we call it acanthosis. And they say, it's okay, just part of aging. It's nothing to it. And especially with Afro-Americans, they get those dark spots, and it's hard to notice. You have to really look for it. The patient will notice. But in an Afro-American person, they get the dark spot on top of their dark skin, and it's hard to detect. On a Caucasian, it's very easy to detect. They turn brown at the beginning, light brown, and then it start getting darker and darker. And most of the time, the physician will just let it be and say, you probably have some venous insufficiency. I think the most important thing for the patient, I always tell my patient, listen, the insurance that you have, either you're going to pay for it out of your pocket, or you have earned it over the years of work in this society. And then you get your Medicare and your Medicaid, or your Medicare and AARP, whatever you get there. It's not free. You earn that through, as a working individual. So you are a consumer. Us as physicians, we are not there doing favor. When you come and see me, your insurance is paying me to take care of you. So you are a consumer, and you have to be a smart consumer. So if you go to a doctor and you have a little varicose vein, and the doctor say, varicose vein is really nothing. The truth of the matter, and Dr. Gonzalez then can talk as the expert on the field, but the truth of the matter that those varicose vein could be the tip of the iceberg. Because I was watching him yesterday after I finished seeing all my patients. Dr. Gonzalez invited me over to the center, to the vascular center.
Just next door to
next door to me. So I finished what I was doing. I said, let me go next door. So I went to watch a procedure, and it's amazing how he can do this. It's like getting blood taken from your vein. It's a simple procedure, very simple. The patient is lying there. One of my patients was just lying on the bed. We're talking about his gout and this and that, and he's just getting the procedure done. But to watch Dr. Gonzalez when he goes in there, just make a little, like putting a needle, taking some blood, except that he's doing the whole procedure through that little hole. So it's amazing with the equipment that he works there. And when you look at the patient, when he went deep inside into the deep veins, that's where the major problem was, in the deep vein, not the superficial one. So
that's what you're saying, isn't it? That it could be superficial, but it could be a lot more than that, right? Is that why?
Yes. So the first part of the question that you asked is why the people let this go for so long. This very same case that we were talking at the beginning, this patient had this for a long period of time. And I asked that question to him, why you let this go? He said, well, in the north I went to see several doctors. Said, not a big deal,
Exactly.
Leave it alone. And then once he started having ulcers, then he went to a hospital to have wound care at the prestigious wound care center nearby. And he has been there for 2.5 years. And nobody have offered him ultrasounds, diagnostics, or definitive procedure when the guy has massive, severe venous insufficiency with these severe nasty ulcers. And for 2.5 years, all what they have done is put a little bit of dressing, put a little bit of a skin graft, but the underlying process, nobody's addressing that.
And so I was thinking...
And we're talking about a wound care center.
And this is a man who's intelligent, right?
Very smart guy.
So this isn't just some guy
and his wife is very educated
it's person. Because they depended on the doctor whom they went to, and he didn't have the knowledge that you have, and...
Yeah, a little bit is like that. A little bit had to do with a lot of, in the last 10 years, a lot of significant advances and in the field of phlebology, which is the field of venous reflux and venous insufficiency. So vascular medicine, that's what one of my four specialties in vascular medicine, phlebology, the venous world, has significantly evolved, both in the understanding of what is in the underlying process, as well as, that the Mencia says, in the equipments that we have nowadays, that with a little simple needle, like the one that we draw blood in the hospital, and then through that we insert a little catheter that is like a millimeter in diameter or less than that. We can do all the procedure. We can come up from all the way low here in the leg, all the way up high here in the groin, and take all of those veins. Before, we had to do a vein stripping, which was very painful. Had to cut here in the groin, cut down, pull the whole vein.
I've seen people with their legs bandaged years ago, right, and they couldn't walk.
Yeah.
But let's go back to some of the show that you've done before here. Let's go back to the beginning of what causes this. Is this hereditary? You told us that women have babies, and it happens, from the pressure. Start over with. All right, so a child is born, and all of a sudden now, as they're aging, tell me what's happening to them.
So the basics is the basic physiopathologic, we call the basic mechanism of why this happened, is because the veins has a very tough job to bring the blood back to the heart. Remember, the vein doesn't have a pump in the food, and the vein like the heart, but we use the muscles to squeeze the blood and pump it up to the heart. And to be able to advance that blood up against the gravity, you need something to hold the blood going up. So we have thousands of valves inside the veins that, as we walk and move our leg, those valves open, let the blood go up. Those are one-way valves. Let the blood go up to the heart, and when the blood tries to come down by gravity, they shut down. So the blood can go up, and when they come down, the valves shut down. So it's one-way circulation up to the heart. For many reasons, it could be family history, professions like standing for too long or sitting for too long, obesity, diabetes, and other conditions can damage those valves. Where those valves now, instead of shutting down when the blood is trying to come down, they start leaking. So the blood go up to the heart when we move the leg, and then the blood start leaking down again back to the leg. As this process continues, this vein start dilating. As the vein dilate, the valve come apart. The more they come apart, they leak more, and they become a vicious cycle. That the more leaking, the more swell, the more dilation of the vein, more insufficiency, more leaking, and more leaking, and more insufficiency. So it's a cycle. So over the years, all of this excess of blood pooling in your legs, that they start oozing fluid to the surrounding tissue, damaging the skin, the skin become very swell, congested, and we test it. And then over the years, that become like a rubber, thick, because the skin gets so much trauma, like a scar after a scar for years and years, become like a rubber leg, and then it become stained, because all the red blood cells break down and release the pigments that become like tattoos, those black spot legs. And then when really advanced to the severe stages, then that skin break, either because the tension is so much or because you have any simple trauma to the leg. And then it becomes so difficult to heal because that skin is so damaged already that they don't heal anymore. And that's what happened to this guy. He said that he was just walking, he rubbed his leg with something in the sidewalk, and after that he developed an ulcer, having 2.5 years. He cannot heal that ulcer. And after we did the procedure 2 weeks ago, in 2 weeks we have seen dramatic changes, almost healing completely.
Well, I think what we're going to do is take the picture that I just saw from Dr. Gonzalez. We're going to put it on YouTube when we put this show on. It's breathtaking, isn't it, Dr.
Breathtaking.
Mencia?
And there's two messages here. Is that if you have vein that advanced, or if you have any problem of circulation, we can help.
Absolutely.
And the other message is that before you get there, that we can really practice preventive medicine. And I had been amazed since I met this man, how many people like you and I just walking and talking, and we do the arterial study of the leg, and we notice that they have stricture of the major artery bringing the blood down to the toes. and Dr. Gonzalez had been able to go in there and open those arteries. And he's so good. He's always, when he does a procedure, he either send me a little video or take a before and after picture. And I'm amazed. I'm like taken every time I see this picture. Oh my God, this patient have very little complaint, but I think I just salvaged a limb and also improve this guy quality of life, because sometimes I see them with the walker or with the cane and they're a little bit off balance. Then I say, when you walk, you get a little bit of pain on the muscle. I say, yeah, I want to check your artery.
So this is a new kind of an idea in a sense, isn't it?
Yeah, I have keep Dr. Gonzalez and his staff
very busy, right? So
busy,
if I came there, what would the prevention, what are you going to do? There's a test that you're going to do?
The first thing I would do is basically the physical examination, check your circulation. And a lot of time when we are seeing the patient, we go from the ankle and the dorsal of the foot, the top of your foot, and check your pulses and go all the way down up to the ground and see what the pulses feel like. So the first thing is the physical examination, where we ask the patient some basic questions to see if they have any potential damage or anything like that going with their circulation. And then they go for a ultrasound. Now, mind you that I have 2 ultrasound machines in my office. I have an ultrasound machine that I use for the heart and to check the liver and to check the pancreas and to check the prostate and the bladder. But then there's very specific ultrasound, and my ultrasound Hector, one of the
technicians who works with this,
and he's gonna bring one of the machine. He just sent me a text this week. I'm gonna have a machine just put in your office, so you have it there, because he see now how devoted I am to getting this thing moving forward. And so then the next step is to do the ultrasound with a specific machine that's going to be very clear, because one thing we don't want to do is take a person that don't need a procedure for a procedure. Right. So a lot of time then the ultrasound are done, they are read, and I get a list. These are all your normal patients. When I see my patient, I say, no, everything came back fine. And according to Dr. Gonzalez, just continue with medical management. That's what we're going to do. So continue, either using the support stacking, whatever we can do. There is none, we don't have to put a little needle and do anything about it. And then the ones that are abnormal, then we get to work on those patients early in the game so that we can dilate those arteries. And you're amazed the way, when they come back to me, Dr. Gonzalez, it's like, I'm a new person. I have new legs. That's how they describe it. I have new legs.
I'm glad to hear that. So I think that for our audience, what we need to do is to remind them that if they have any kind of discomfort in the leg when they walk, if their leg feel heavy, tired when they walk, or at the end of the day, they should be checked. Also, patients with diabetes. Sometimes they have neuropathy, that means damages in the nerve, and they don't feel their legs very well, their foot. And they might have an ulcer, they might have severe blockages, and they don't have any pain symptoms. They just don't know. Like this lady that I show you, the other picture, that she had that ulcer in the leg. She even fell after an accident. She didn't even feel any pain until she came to the office, and I saw that big black toe with a big blister, and she's diabetic. So. And she have underlying arterial and venous insufficiency. So that's a setup for the gangrene. If she doesn't recognize that, she doesn't come to see me, they get infected with a poor circulation, she develops gangrene in 24, 48 hours, she can lose the whole leg. So that's why it's important that all of our patients with any kind of ulcer in their foot or legs, patients who have pain when they walk, or heaviness or tightness in their legs, if you are a diabetic, you please come to see us. Don't wait until it's too late, because we really want to save your limb. We want to keep your limb healthy. We want you to be able to do the things that you want in life and not to be limited by losing a leg.
Okay, so varicose veins, we know what's the thing? The spider veins. Let's go to are spider veins a beginning? What really are spider veins? How do they happen?
Well, the spider vein alone is considered by all the doctors in the field, as well as the payers, the insurances, as a cosmetic issue.
But is it
When
in
it
your
is-
mind?
when only exists alone as a spider vein, and there are
Just
some
spider
people
vein, yeah.
that have some very superficial spider vein. Sometimes you see in patients with a very white skin, females who had a baby or so and have a little bit of a spider vein. Those tend to be relatively not really detrimental for your health in general. It might not look good. It might be a little bit of cosmetic. But in my opinion, most of the spider vein that I got to see, they're a mix of a spider vein with
Right, exactly.
significant venous insufficiency underlying there. And then you only see on the surface and the skin that a lot of a spider vein, but underlying there is significant venous insufficiency. And then when I press the leg, you see the edema, the swell, and they say, oh my God, yeah, my leg killed me every day. At the end of the day, I just really tired my legs. And at night, I cannot sleep. I have throbbing in my leg. They feel very achy, very painful. And then, yeah, I only see the spider vein. But we really need to test to see whether underlying those spider vein, there is significant leaking of those valves and significant venous insufficiency and swell and edema.
Exactly.
So will
Yeah.
the ultrasound show them?
Absolutely.
Yeah, absolutely.
That's fundamental.
That's your triage. Once you get the
That's
ultrasound,
fundamental.
yeah.
The ultrasound, with a simple ultrasound that takes 10, 15 minutes, we can scientifically document the size of these veins, what veins are dilated or not, whether they're deep, the superficials, whether there is any perforator, tributaries, accessories, all kind of different type of bad veins that are diseased, and we can test those valves. We can scientifically measure in milliseconds how much of these valves are leaking with a tremendous accuracy.
Okay,
And
so
then-
where do you stop? Now let's go up the legs. Keep going up the legs. Where
yeah. We
where
as-
else are you
we do,
concerned?
We do it from the ankles all the way up here to the groin. We check the whole venous and arterial system because it's both. You want to be sure that the veins are doing their job, bringing the blood back to the heart the way that it's supposed to. But we also want to be sure that the blood is flowing down from the heart to your legs, and you don't have any blockages.
Okay,
And
guys.
many times you have both. We have both.
Guys, I have to stop you here.
Okay,
Listen,
okay, good. Stop
Let me
us.
stop you here.
Okay.
Because people are listening.
Yeah.
And
Oh yeah, we
you
have to
know,
tall them how to get in touch with you.
how-
Oh my gosh,
how
I'm
they
so
gonna
sorry.
find this
How are they
guy?
going to find us? Right. Well, we're going
How
to
they gonna
fly
find this
flags.
guy?
Okay. So we're
so
going
we
to
have
call.
to talk about his
Right. Okay.
his
Well, first let me
website.
tell you about Dr. Mencia, Adult and Geriatric Medical Center at 954-489-1345. That's 954-489-1345. I was just there yesterday with Mother Ratasha, and Dr. Mencia. I have to applaud you because I know she is listening. She wanted me to be sure to tell you saved her life. Mother Ratasha is a worldwide wonderful spiritual leader, and she had a problem, and she only wanted to go to Dr. Mencia, and he took care
I'm
of her.
always
And
honored
Rashad.
to see her.
Yes, you
Yeah,
did a
to see
wonderful
both of
job.
them. Yes.
Thank you. He's located in East Commercial Boulevard. And we have Dr. Manuel Gonzalez, who is right next door.
But the good thing is that
Yes.
you can see me in Dr. Mencia. We are one
Yeah.
group.
Yes.
We're together.
Yes.
So you only need to call
You
one
can
phone
call that
number.
one number and-
954
489
489
1345.
He can even read
and
backwards.
with what that phone number, with one phone call,
Yes,
you
yes.
have an expert geriatrician that can
Right.
assess you head to
Do the
toe,
initial assessment.
put together everything. We can do the diagnostic ultrasound studies, and then once we have all of the information, I come in, I give you final evaluations, put in all the ultrasound, the geriatrician assessment, and we can then go from there.
And you
But
know what he
because,
said, when am
but
I
because-
coming?
Yeah, but
right?
because the program goes from Vero Beach all the way down to the Keys, if there are people in Miami or the Keys that need to see Dr. Gonzalez that are having problem, you can still call the number and let us know. And we have center in Miami that we can refer you to see Dr. Gonzalez there.
And for any information, if people want any information, we have a website with all of this vascular information.
It's a great website.
It's www.heartandvascularcenters. And this centers with an S at the end because, like Dr. Mencia said, we have centers from Miami,
Key.
Fort Lauderdale, and now in Palm Beach, and we have offices in the Key West as well. So we can help any patient with this problem. If you want to call a 1-800 number, is 844-90-HEART. 844-90-HEART. And for all of our audience in the area, please call the
Dr.
center, the
Mencia's
geriatric
office,
center
yes.
at 954
489.
489.
Hey, you're taking my job away. I'm supposed to do this. And what is this? He wants to be, see, he's the kind of guy, he's so gorgeous. You get him on the show, and now he wants to run the show. I'm leaving. The two of you could do this. When are we going to have our television show? Then, the television show, then we can all do this together. That's okay. Anyway, it really it's been a great pleasure to, of course, have you come with Dr. Mencia, Dr. Gonzalez. And I guess you want me to come in, and I should be the guinea pig in the sense for the audience, since I don't have pain in my legs. But there is a little place there that we saw that I guess we ought to take care of, because I love my legs and I want to make sure my legs stay good.
So who's
right?
coming up next? Who's coming up? Dr. Williams?
Dr. Leon. Absolutely.
Bill.
Dr. Bill Leon, who
Bill
saved my
Leon.
husband's knees, and he's the best orthopedic surgeon. I mean, he's my guy. So he'll be on at 7:30.
I know Dr. Leon since I first came into town, and we had been friends ever since. One of the best orthopedic surgeons I have come across.
Oh, he is. He is a caring, wonderful, wonderful doctor. You it's starting to rain too. Well, everything happens when you're on the show. So thank you. Thank you for coming in for Thanks, both doctors, and we do hope that people won't wait until I see those gory pictures. And let's just get to Dr. Mencia, and he will examine you, and then we'll let you know. And then over the next week, I really will come, and then we'll talk about it. Right? Yeah. What you did, right? I was thinking how you would do it here in the studio, just bring your stuff, and we'll do it. But we would do that if it were television.
We do that. We go to the patient's home. We go to the nursing home.
And you can bring your stuff. So, but we have to be able to televise
it. But don't have Dr. Leon come and do procedures.
Okay, we'll be back right after this commercial. Thank you. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.